Okay, sir. Thank you so much.
Okay. In this picture, you can see how to do elbow diagnose. Okay. Then on thumb side, you see between, you see on cubital fossa, two finger below it, there is on thumb side, there is cervical point. Okay. On another side, there is lumbar spine on ulnar side. Radial side is cervical and cerebellum. Above the elbow, there is cerebellum. Below the elbow, there is cervical. Then between, below the elbow, there is thoracic spine, and above there is basal ganglia on the biceps muscle tendon. Then on lateral, there is lumbar spine, and on ulnar side, there is lumbar spine and cerebrum. All these points are for diagnose. Okay. First of, then go for next. He could diagnose. Then you do diagnose on LI4 on both hand. When you palpate both hand, then one is more painful. Then go for elbow diagnose. After elbow diagnose, you think about needling. Which side we have to needle? That side, which side is very painful and more painful, on that side you have to put needles on basic points, on brain points. Okay. All three points on upper arm, cerebrum, basal ganglia, and cerebellum. 3 points are brain points, and on lower portion of elbow, there is point cervical, then it is upper thoracic, then lumbar area. Then point A, D, and E. Now, second, next. Here you can see the diagnose of neck diagnose and cranial nerve points. When you're doing neck diagnose, then you find painful area or neck, then you have to put needles according to neck diagnose on the cranial nerve points. In cranial nerves, you can see all the points. On neck diagnose, you see on the sternocleidomastoid muscle, there is between, in between, the point is liver. Dr. Rahim at Dow, what you want? Rahima, Dr. Rahima, you have any question?
Excuse me, sir. Excuse me, sir. Let them switch off their mic. Let them mute, please.
I request you all, please mute yourself. I am not muting you all because I think if you have any question, then you ask. But if you open your mic, then it is disturbed to others. There are 40 to 5 members others except you, those want to learn. So please don't share and don't open your mic. Then on sternocleidomastoid bone, there is in this sternocleidomastoid muscle, there is the point of lever point. Then about from lever point 45, when you go for 45-degree up, and on the side of sternocleidomastoid muscle, then there is point heart. In front of liver on anterior side, there is pericardium. Then from liver to gallbladder 45-degree, then gallbladder. When you palpate the liver point on sternocleidomastoid muscle and it is painful, then you have to put the needle on cranial nerve 10, which is vagus nerve. When you put needles on cranial nerve point or Y spleen point, then the pain and or tenderness immediately. So your needling is perfect and you got good results. I told you the liver is the most important organ of our body, and vagus nerve is most important nerve of our body. Cranial nerve, vagus is very, very, very important because it is treating all the parasympathetic moments, and it balances parasympathetic and sympathetic workings. So you see, go for next, Dr. Nida. Yes. Here is the point. Basal ganglia, cerebellum and cerebrum. Almost you asking me every time, where is the point location? Above A point, there is cerebrum, then cerebellum, and between both A point, there is basal ganglia. Basal ganglia is control our voluntary movements. Cerebrum and cerebellum control our equilibrium and control our balance, body balancing. Cerebrum control all the moments and doing all the moments, because all the functions are happening in our brain only on cerebrum area. Then go for next. Ja. Here is the point A. Eyes, nose and mouth. When you have problems in your face region, then the point A, eyes, nose, mouth. If you have eyes problem, then use eye point. If you have nose problem, then nose point with A point. And if you have mouth problem on facial paralysis, then you can use point A and point mouth. Then here is one new thing. You see below the point A, there are 2 points of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, then 2 point of CS. 2 point of LS, then 2 point of TS, Then what is the meaning of this? LS means lumbar spine, thoracic spine, and cervical spine. Those 6 points beside the eyes, nose, and mouth point. When you palpate in this area and putting needles on this point, then yellow point you see on this point. If you have frontal areas disease, then you use medial side point. And if you have posterior side pain, then you have to use lateral side point. Same as in thoracic region, if you have in problem in chest region and in thoracic vertebra region on front side, then you use medial point. If you have back in scapular region and all, then you use lateral point. Same as cervical spine point. When you have thyroidism problem, throat problem, a speech problem, then you use medial side point. Otherwise, you use lateral side point. You understand with me?
Yes, sir.
Sir, please, can you repeat it again, please, sir?
Okay. Here you see the A point. Between A point, on the same symmetry of A point, there is point of sensory organs, eyes, nose, and mouth. Okay. On both sides. Then on both sides, there are points of extra points for lumbar spine, thoracic spine, and cervical spine. Okay. Then there are two parts, front body and back body. When you have problem in upper in front side, then you use medial side point. If you have problem in back side, then you use lateral side point. Because between this point, eyes, nose, and mouth point, lateral to eye point, there is lumbar spine for back pain, spondylosis, and all. And when you are using front point, then it is for abdominal and lower limb problems. Same as thoracic spine and cervical spines. For front body, you use medial side point. After diagnosis of elbow diagnose and LI4 diagnose. Then go for next. Jump. Ankle, posterior hand, you see posterior hand and anterior hand. In this picture, you see posterior hand and anterior hand. This is the area on lateral side. This is the area of UB58, and in medial side, it is the area of kidney 7 and 8. Okay. So when there is a problem in your fingers and your finger is not opening fully, then you use posterior hand point, lateral side point on same side. And for when you are not able to close your fist and flexor your fingers is not working, and you are not flex your fingers, you cannot hold anything, then you use anterior hand point. Okay, you are understand? Please mute your mic. Amida, Dr. Amida, please mute yourself. If you have any question, then please open your mic. Otherwise, not open your mic.
Hello, Prof.
Excuse me, sir.
Yeah.
Hello, sir. I want more clarification concerning the posterior aspect of the brain, the urinary bladder, and then
Not urinary
the
bladder.
other medial side.
Sister, I am telling you.
Sir?
I am telling you. Wait.
Okay, sir.
Then you see on your ankle, medial malleolus.
Okay, sir.
There is the point of brain point. When you have any problems on brain and this point is painful, then you put needle here.
Okay.
Okay. Then upper body, middle body, and lower body. It is not urinary bladder. It is upper body. UB means
sir.
upper body, middle
Okay,
body,
sir.
and lower body.
Okay,
When
sir.
you
Thank you.
when you find pain on this area,
Yes, sir.
and when you want to treat back pain and all problems, then you use upper point for upper body,
Okay.
for upper problem, upper body problem, then middle body for middle problems, and then lower body point for lower body problems.
Okay, sir.
There are three
Thank you, sir.
cavities: upper
Yes, sir.
limb, middle, and lower limb.
Okay, Prof.
Yes, sir.
How do we
Yeah.
measure? How do we get the measurement of those points?
There are 3 points on equal space. Very near. Lateral side point treat the back side, and medial side treat the front side. Mohammed Garba, you have any question? Dr. Mohammed, you have any question?
Sorry, sir. Sorry, sir. I have no question, sir. Go on, sir.
Then why you open your mic?
Let me make it up, sir.
Close your mic, otherwise I remove you.
Sorry, sir.
Yeah. I
Sir,
requesting
are
you
we
all.
using one needle for all, or for each point a needle?
You have to needle each point.
Sir, please, I have a question. This brain point, is it at the medial malleolus or the lateral malleolus?
On both sides. Medial malleolus
sir.
treating front side, and lateral treating back side.
Okay, sir.
Sir, you talked about one not being able to use the fists. So which of the points? Is it the brain points we are using?
When you are
When
not
there's
able to make a fist, when you are not
Yes.
able to make a fist, then anterior hand point. The point location is kidney 7 to 8. Area is kidney 7 to 8. When you are not open your fist, you are not able to open your fist, then you use posterior hand. What you want? Why you are not muting yourself? Dr. Anita, without any question,
Yes,
if anyone is unmute without any reason, if he have no question and he is open mic, then remove him.
Okay, Prof.
If they have any question, then don't remove. Otherwise, remove him after 3 minutes.
Okay, Prof.
Hello, Prof. Please, I
Wait
still
for
have a
1 minute.
question.
If he is asking any question, then no problem. If he is not asking any question, then remove.
Okay, Prof.
Sir, I still have a question concerning this anterior hand part, sir. Do you mean this anterior hands, if you are using it for somebody that is not able to open his or her fist, the anterior part, is it the one that contains the kidney 7 and 8, sir?
No. When a person is not able to when a person not able to open fist, then use posterior side.
Okay.
UB 58 and 59 point. Between 58 and 9. If he is not able to make a fist, then use anterior side.
Okay.
Okay. Then upper body, middle body, and lower body. I tell you. Then isomotocopy. Already I have told you. Next. Go for next. I am preparing this. Balance points. Yesterday someone is asking to me about tinnitus. This is protocol for tinnitus. If you want to take picture, then you take picture. This is the point for tinnitus. When there is ringing bells in ears, you can use all these points for ringing bell in ears. Then go for next. In this picture, you can see all the points. Master key point. Except master key point. All the points, basic point on yang side, situated on the lumboidal suture. And then you find how to find lumboidal suture. Anyone tell me? Anyone tell me how you find lumboidal suture and lumbarda point?
It is at the C point, sir.
Yeah.
At the C point, yeah.
No. I am asking about how you locate lumbarda point. Yesterday I told you the measurement from occipital protuberance to lambda is 6 to 8 centimeter. Maximum 8 centimeter, minimum 6 centimeter. Then go on lateral side. On sigmoid bone. Okay. All the points are same edge in front. Okay. Then go for next. Go for next. Next. Go for 39. Dr. Anita, go for 39. Yes. Oh, it is going one back. I am going one fast. 38. Yes. In this picture, you can see the all lobes. Then you see frontal lobe, parietal lobe, occipital lobe, and temporal lobe. You see in this picture, there is written motor center and sensory, blue and red areas on front side. It is motor area and it is precentral sulcus and post-central gyrus and precentral gyrus, and between yes, doctors, tell me what you want.
There's a mistake. I don't want anything, sir. Sorry, I just joined.
And auditory speech for sentence making area and motor center area. These are brain's functions. Every area is doing a different cortex primary mainly prepare and executes movements of the limbs through coordination with other part of the brain is choosing the appropriate motions. The primary function of the motor cortex, it is to generate signals to direct the movement of the body. It is a part of the frontal lobe and it is the anterior to the central sulcus. It consists of the primary motor cortex and the supplementary motor area. Then the sensory motor cortex. The sensory cortex Please go for 43.
Prof, can you see it?
Yeah, 43.
Okay.
43. Yes.
43.
Now in this picture, you see the central line is head area. It is very between the center area and central line. This line is 4 centimeter line, 2 centimeter up and 2 centimeter down. When we use this line for head and face area problems, when there is a head pain, migraines, epilepsy, seizures, insomnia, anxiety, depression, then we use this head area point. It is 4 centimeter in length and 2 centimeter below the hairline and 2 centimeter up the hairline. Okay. Then second point is stomach area. The stomach area is directly above the pupil of eyes, center of eye, above the center of eyes, and it is 2 centimeter line up from hairline. It is 2 centimeter directly above the center of eyes in yellow color, and it is up to 2 centimeters. It is used for stomach problems, gastritis, and all type of stomach problems. You can use this. Then there is thoracic cavity area. Thoracic cavity area, when there is the problem in the area of thoracic spine area, and all the organs, those are situated between the thoracic case, like asthma, bronchitis, then heart palpitations, then liver problem, gallbladder problem, spleen problems. Then we use the point thoracic cavity area. Where it is between head area and stomach area. The next point is liver and gallbladder area. That is in this picture in green area. It is directly below the stomach point and 2 centimeter long length. Okay. For liver and gallbladder problems, you can put needles on this area. Then there is reproductive area on the corner of head. Directly when you go 4.5 centimeter, 4.5 chun from center to lateral, or you go on the corner of head, then it is 2 centimeter long line up side from hairline. It treats all type of reproductive organs disease like low sperm counting, premature ejaculations, then dysmenorrhea, amenorrhea, leukorrhea, miscarriage, all type of reproductive organs disease on male and female and both. Then other area is, next area is intestine area. You see in purple color, that area, yeah, corner between beneath the and under the toward the eyes, this area is 2 centimeter long line. It treats all type of disease on large intestine and in small intestine, like duodenal ulcer, constipation, and all type of inflammation in IBS, inflammatory bowel disease. Okay, then you use these points. Then go for next. Yes. Yes, you can use it. Dr. Joseph, you have any question? Dr. Joseph? You have any question?
No, sir.
Okay. Now, this is the important area in this picture. All the area is very important. Then anyone who can describe this, all the areas? Anyone who want to learn and who want to speak on this area and tell about these areas? How to locate motor area, then how to locate sensory area, how to locate praxis area, how to locate speech area, then speech area 3 and vertigo, hearing and vertigo area, then orient tremors and vascular dilation and contractions area. Anyone who want to tell, please
Yes, I
tell.
can try.
Okay, good.
Okay.
Tell.
First of all, we'll look for the center of the line between the glabella and the occipital protuberance. Then
Yes.
the motor area is 0.5 centimeters behind that line. That's the
Yes.
motor area. But according to the positioning of the central gyrus, that line is divided into 5 parts. Into 5 parts. Yes. That's the motor area is divided into 5 parts. Can you hear me? Can you hear me? Yeah, sir. Can you hear me?
Go ahead, or continue.
Hello, can I continue?
Yes. All are understand with this line? Yeah.
Okay. Okay. So the motor area is divided into 5 parts. The upper 1/5, second one. The 2 upper fifths controls the lower part of the body. The last 1/5 is the speech area 1. Then from the motor area, 0.5 centimeters 0.5 centimeters posterior to the motor area is the sensory area, and it's still divided into 5 parts, just like the motor area, with same description or whatever. As the first 2/5 is the lower part of the body, Then the lower part is now the upper part of the body. Then for speech area 3, it's 1.5 centimeters above the ear, the tip of the earlobe, the most prominent part of the earlobe. But then for the speech,
It's 4 centimeter area.
I think
Dr.
it's
Emre, it is 4 centimeter area.
yes,
And
the
it
4
is
centimeter
behind
area,
from it is behind from ear center.
ear center, yes, 4 centimeter behind.
Yes.
Then the praxis area is on the what do they call
Corner
that
of
one?
head.
Yes. So you have the
Corner of
praxis area.
head. On back
Corner
side.
of the head,
Yeah.
yes. Corner of the head. Then you measure 2 meters. I think 2 centimeters.
2 centimeter, 2
behind
centimeter, 2 centimeter. 2 lines.
2 lines, yes. Which should be parallel to the central line. That's the line connecting the glabella and the occipital protuberance. Then I think I made a mistake. The lower border of the motor area should be a line from the top of the eyebrow to the end of the occipital protuberance. So that should be the lower border of the motor area and the sensory area. Then the vascular and the chorea tremor area is 0.5 centimeters anterior to the central line. So that central line. That's all I can say. It's kind of confusing.
Yes. So so nice, Dr. Emre. So nice. I proud on you because you have a dare to speak out. Okay. Don't fear. If you do wrong, then you learn good. Okay. So these all areas you have understand. Now you see the motor area. It is divided in 5 parts. Then upper 1/5 part for lower limb, middle 2/5 part of for upper limb, then lower 2/5 part for head and face area. Same as sensory area part in 5 divisions. Upper 1/5 of sensory movement in lower limb, then 2/5 for upper limb, then 2/5 for head and face area sensory movements. Then hearing and vertigo area directly above the ear, 1.5 tune above the ear apex, and it is 4 centimeter line. Okay, 2 centimeter anterior side and 2 centimeter posterior side. Then behind with this line, hearing and vertigo line is 4 centimeter. Then another line start middle of this line and go 4 centimeter back. That is speech area 3. Okay. Then speech area first is the 1/5 part. You see 1/5 part of motor area for head and face area. Okay. Then area of speech second. It is the back side of you see urine bladder 8 to 9. Then praxis area, it is the corner of backside of head and parallel to sensory area, and it is 3 centimeter behind the sensory area. and make a V. Then there is area of chorea and tremors area. Chorea and tremors area 1.5 centimeter anterior to motor area, and it is 4 centimeter line. Then 1.5 centimeter again we go for anterior side. Then there is vascular dilation and cortection area. It is for edema and spleen problems. Chorea and tremors for Parkinson disease. Okay. Then
Yes, sir.
another area I will tell you. From vascular dilations area, you go lateral to 2 centimeters. Go for next. I think there is another PPT. Go for next, Dr. Anita. Motor area. Already tell you. Sensory area tell you. Next. Then next. Yes. Homuncles. This is motor cortex and sensory cortex, homuncles. In this picture, you can see all the organs are situated on precentral or postcentral gyrus. And precentral and postcentral gyrus width is 1.25 centimeter. Okay. The next area. Next. Go for next. Foot motor sensory area. Here you can see the foot motor sensory area. It is very useful area because it is directly connected with hypothalamus and corpus callosum. So this area is very important area for all type of limb problems, lower limb problems. All type of problems in foot and in lower limb. And whenever you use this area, use bilateral. In Parkinson disease, you use this area. Okay. Then another area is starting from the line. You see where this motor area start. The midpoint of mid sagittal line. Midpoint of mid sagittal line. Then when you go 3.7 centimeter anterior side, 3.7 centimeter anterior side and 2 centimeter lateral side, then there is a line of 4 centimeter long for emotional and split area. What is the location? From midpoint to 3.7 centimeter anterior, then 2 centimeter lateral. A 4 centimeter straight line for emotional and split area. That is very useful for emotional trauma and emotional behavior and all type of emotional stress. The the split and emotional area is very, very useful for all patients, especially for ladies patient. Then go for next. Go for next. Balance area 56. Yeah. Show the only picture in big size. Dr. Nita, adjust the picture only big size. Yeah. In this picture, you can see there are lines from occipital protuberance. Okay. And 1 centimeter lateral to mid sagittal line. These lines are for visual area, for eye problem and visual coordinations. And then below the occipital protuberance and 3.5 centimeter lateral to mid sagittal line, there is the balance area, which is used for both sides in paralyzed patient, in Parkinson patient, and when there you see there is any disturbance and any disbalance in body, then you can use this point. It treat balance. It is its work for only equilibrium. It have a very good results. When you have excess thirst, then you use balance area point and see the miracle.
Excuse me,
Sir,
sir.
please, what is the direction of the needle, sir? Is it posterior to anterior, anterior to posterior?
Top to bottom. On this area, always needle top to bottom. Don't go bottom to top. Top to bottom.
Okay, sir.
Are we going
Okay.
to use it bilaterally, sir? Are we using both of them bilaterally?
Pardon, my sister?
I said, are we going to use it bilaterally, both sides?
Yeah, bilaterally.
Okay,
because
sir.
it balances
Thank
your body.
Yes, sir. Can this also work for foot drop?
Yes. For
Okay.
foot drop, you use foot motor sensory area.
Okay, sir.
Sure.
Okay, sir. Thank you, sir.
Okay. For hormonal imbalance, you can need this area. Use this area for excess thirst. Okay.
Hello, Prof.
Yes.
Please, I said for the hormonal imbalance is what? Is it the balance area for hormonal imbalance?
For balance area and foot motor sensory area and reproductive area.
Hello, Prof.
Yes.
Good evening, sir. So,
My sister.
the hormonal imbalance, and then for the people undergoing menopausal stage, and then people with PCOS, is it the same thing? Can it be used for both?
Yes. For reproductive, I told you today, reproductive area, then foot motor sensory area, then balance area, then upper 1/5 area of motor and sensory area.
Okay. So for people going through menopausal stage too, they can use it.
Yeah, you can use. But during menopausal, during the period's time, you not use it.
Okay.
Avoid needling on menopausal days.
Okay. So, sir,
because it my sister I told you, listen, when you are putting needles, it increase the blood flow.
Okay.
Okay. When you put needles during the period time or menopausal time, then it may cause of excess bleeding.
Okay. Okay, sir.
Okay. So
Okay, sir.
I'm sorry,
avoid
sir.
that
Sir,
time.
please say it again, sir. Please, the thing is cracking. Please say it again. Sorry, sir.
For hormonal imbalance and for gynec problems and for impotence, when you are using these points, then use bilateral foot motor sensory area, bilateral balance area, bilateral foot motor sensory area, and motor and sensory area, then reproductive area, bilateral.
Bilateral.
During the period time or menopausal time, don't use these points and don't do any type of acupuncture because it make blood flow and it may be cause of excess bleeding. Okay, my sister.
Yes, sir. Thank you, sir.
What is bilateral, sir? How someone
Yeah,
goes
bilateral,
bilaterally, sir?
bilateral.
Now,
Sir, how can I do bilaterally, sir? I don't know how to do it, sir.
Yeah,
okay.
bilateral.
It means both sides, sir.
Yeah,
Okay, both
both
sides is
side, both
bilateral.
side, both side. Yeah, bilateral means both side.
Ẹjọ́ lọ máa kọ́ kí náà tó ń pè dáadáa. Kí náà ń pè.
Bilateral.
Then you go for page number 73. Yes, no problem. You make only picture big. Yes. Now you see, this is next type of scalp acupuncture. Today we are doing 3 type of scalp acupuncture.
Sacra.
Yeah, Doctor Abidon, you have any question? Dr. Ahmed Aisa Abidun, you have any question?
No, sir.
Then please mute yourself. It is my
Okay,
humble
sir.
request.
I'm sorry, sir.
You see, here is DU24. Then there is a head. You see head area. This head area is used for face and head area problems, eyes problem, face problems, then insomnia, excess anxiety, depression, migraine, then epilepsy. For all these problems, you can use this area. This area is 1 chun by 1 chun. Okay. Then next area, start from DU23 and go DU 21.75. Means there is the difference between DU21 and DU22. There is the difference is, I think, 1.5 chun. Then this area go half chun behind the DU22 and 1.5 chun lateral on both sides, and it cover with urine bladder meridian. Okay. Then this area is used for upper body front side problems, asthma, bronchitis, asthma, heart palpitations, excess heart rate. Then chest problems and shoulder problems. Then middle geo. Middle geo is the area 1.5 chun. Again 1.5 chun. This area cross DU20 1.5 chun. Okay. 1.5 chun cross the DU21. And this area is 1.5 chun. It is used for treating all type of abdominal, upper abdominal and lower abdominal problems. In this liver problem, then duodenal ulcer, all type of ulcer, then all type of intestine problems, used for this area, 1.5 chun area. Then next area is lower geo area. The lower geo area half chun above the middle geo area. Okay, it overlap to middle geo. Half chun it overlap to middle geo. Then this area is used for all type of gynec problems, all type of male problems on lower limb. Okay, premature ejaculations and low sperm counting, excess bleeding, PCOD, PCOS, all type of problems you can treat with lower geo. Then next area is DU21 to 1 chun you go already. Then you go for DU20 to 21 half. It is half chun area on both sides. It is vertex and perineum area and foot area. It is treat headache of vertex in top when there is pain in top of head and there is pain in the foot and foot problems and hip problems. Then you use the area of vertex and premium foot area. Then behind U20 there is 0.5 area, cervical region area. It treats the cervical region problems from back side, not from front side. Okay, neck pain and shoulder problems, and sometimes it is used for nerves. Those are in hands because cervical region is responsible for all hand movements. Then the thoracic area is 1.3 chun area, 1.3 chun area. then it is for thoracic region problems. When there is pain in between shoulders, then shoulder problems, then upper back pain, all these problems are treated with thoracic area. Then lumbar area, all type of lumbar pain treated with this lumbar area. Then sacral area, it is finished on 17. DU 17. Then it is one chun area and used for sacral problems and hip pain, coccyx pain. Then you can put needles here. Now go for next. Go for 78. Or 79. Yes. Here you can see there is center of DU 20. Then all side of there is points UB 7 and UB 8. These are hip area and shoulder area. Back points are for shoulder and front side point are for hip area, hip and lower leg problems. And foot area also here. Hip and foot. It can treat the whole leg. For cervical region, cervical to hand fingers, you can treat with shoulder area. Now, if you have any question, then clear in 5 minutes. If anyone have any question, then please ask.
Hello, Prof.
Yes.
Sir, please, can one combine Joseph Scalp and Yamamoto together?
What is the need of combining? One day you do Yamamoto, next day you do Jyosunfa, next day you do Scalp acupuncture.
Okay. It's okay, sir.
If you're doing all in one day, then next day your patient is not come. Because he have a fear. Oh, you are putting so many needles. When you use one single system, then how many needles you use? 10 to 15 needles. When you use 3 systems, then how many needles you put? More than 30 needles. The patient gave you money same and same thanks. Then why you go for more needles? One by one. You can use body acupuncture together scalp acupuncture. Okay. And in body acupuncture, there are only 29 points. Those are very effective. There are not more points. If you're using all the points, then in Tung scalp acupuncture and in TCM, there are only 100 points. Those 100 points treat the full body. Now, if you have any question, then please ask.